So I am at about a month out from when I had my umbilical hernia repair surgery with mesh open. It was not laparoscopic. And I'm just going to give a quick video on a checkup of how the wound is doing, how I'm feeling about it all. The surgery felt, I mean, it was really painful at the beginning, but right now it feels really good. I can hardly even tell that I've had surgery. I do have a mild constant pain. It's so mild though. Like I had the umbilical hernia for 5 years. So, I mean, there was always the pain of the mass coming through the hole and stretching it. I always had that. And so I think I got used to that. So the mild, super mild pain that I have now, from the mesh, I guess, I'm not sure where the pain's actually caused by, but it's totally doable. Like it doesn't even bother me to the point that I think about it. I just notice that I constantly have this dull pain, more so when I put pressure on it. Like if I was driving to the movies yesterday, and to see Avengers, which was awesome. But I noticed sitting in the car that there was pressure on it because you're sitting. I'm fat. I'm a fat guy, so there's a lot of abdominal pressure anyways. I have a lot of visceral fat inside. That's another story too, by the way. I'm looking into sleeve surgery because I am fat and I know it can hurt this wound, the healing of this properly, and it can cause it to recur in the future. So I really need to lose weight. But back on topic, I noticed the pressure then. I noticed that I had this abdominal pressure just at the site. I can feel it. You know, in my mind's eye, I can see where the repair was, and I know about where it was. Also, sometimes if I cough or laugh or anything that causes my stomach to, scrunch up a little bit, I can still feel just a small amount. It's not like it was before I ever had a problem where you never really felt anything. I always feel something, but it's so mild that I'm not complaining. I'm just saying it's something that I notice. I also notice that if I overeat, which I do a lot, I'm addictive. I'm a food addict, but I'll overeat, and it's more so then I can really tell that internal pressure is causing a little bit of pain. And maybe it's the mesh being kind of pulling on the surrounding flesh. I don't know. I don't feel like I'm tearing anything. I don't feel like I'm overdoing anything at this point. I'm 1 month out in a day, 1 month in a day. I really feel good. I think the repair was awesome. I'm going to show you what it looks like and cut this video off. So, here's the repair. The scar is pretty visual. It's pretty much there. I don't think it's going away. I don't know. I had this knot, which is still there, but it's getting smaller and smaller and smaller every day. I'm still treating it with a vibration. I'm still kind of rubbing it. I'll reach in and rub it, and I feel a little bit of the surrounding knot tissue here. Not so much here. I think this part that we used to trail down is gone, and it pretty much is just in this immediate circle. But it's going away. I can tell it's going away. It's getting softer. It's less prominent. Overall, I think that it looks good. It looks small. It feels good. Inside is starting to, you can see a little deeper in there now. I can stick my finger in there relatively easy without obstruction. So I'm happy with it. I can't complain. And if I would, who's listening? So anyways, I hope yours is healing well. If you had surgery, you've got to be careful with it. It definitely feels better to the point where you think you can take it, go a little harder, but don't go until at least 6 weeks out, I think is the standard. You can get back to doing all of your normal stuff. So take care of yourself. Good luck with your healing on your umbilical hernia open mesh repair, or even laparoscopic.